Okay, so today guys we're going to talk about dual plane, and what that is a placement of the implant. There's three different options. You can go in front of the muscle, under the muscle, or dual plane. Dual plane and under the muscle are pretty similar, but I'll explain it to you guys so you get a better idea of what's actually happening. Now let's say I'm you, this is your implant. That goes here and sits on your rib cage. Your pec muscle comes over the top of the implant like this, but it doesn't cover it completely. The bottom's left open, and that bottom part of the implant sits under the breast tissue itself. So you've got muscle here, breast tissue which covers the whole thing, and that's what you see from the outside, obviously. To make it a little bit more clear, hopefully, I'm going to use some handy visual aids here. So I've got two pocket squares on my table, and I want you to imagine that this is a patient lying down, the head's up here, feet are down here. So when we do a breast augmentation, I'm going to make an incision here at the bottom of the breast, lift up that breast tissue. And now what I can see is your pec muscle here. So I make another little pocket under the muscle, put the implant under like that, not completely, but about halfway to 3/4. And then we bring that breast tissue back down like this and stitch everything closed. Obviously I don't fold your breast up like that, but that's just for the sake of illustration. So hopefully that gives you an idea of where the implant's sitting in relation to breast, muscle, and your body. So with the dual plane placement, that's my preferred placement for a number of reasons. The first is that it doesn't look as fake. If you have an implant in front of the muscle, it's just sitting here, there's nothing covering the top, and so oftentimes it will just look like it's stuck onto your body and you can see the top line of the implant. This of course depends on how much soft tissue you have, because if you have quite thick tissue here at the top of your breast, it will cushion the top of the implant. But if you're very lean, then you're definitely going to see the top, and people say it looks like bolt-ons, or that you've got balls stuck to your chest, that sort of appearance. The other reason I like dual plane is that it has a lower risk of capsular contracture than going in front of the muscle. And this is just due to the fact that we're as far away from the breast tissue as possible. We're not as likely to get contamination from the milk ducts, and where bacteria can get in and around the implant and then lead on to capsular contracture down the track. Sometimes I won't use dual plane and would prefer the subglandular placement. This really depends on the individual, as well as what they want, what sort of look they want, and their extracurricular activities. Say for instance, someone who's a bodybuilder or a fitness model, very lean, doesn't want to lose their pectoral strength, which can happen when you go under the muscle. So the option for them is to go in front, and they have to realize that it is going to look a bit more artificial, but there will be absolutely no interference with their muscular development at all. So that's a reason why someone might choose to go subglandular instead of dual plane. Okay guys, so that was dual plane, one of the positions that we can put the implant in. Let me know if you have any questions or if anything else was unclear, and we'll see you next time.